Welcome to Chillin' 101. We hope this video helps.
In this video, I will explain how to do a medical examination. First, understand that a medical examination is a comprehensive assessment of your overall health. Before your appointment, gather any relevant medical records, medication lists, and a list of questions or concerns. During the exam, be prepared to discuss your full medical history, including past illnesses, surgeries, and family health history, with your healthcare provider. During the physical assessment, your doctor will systematically examine various parts of your body. This includes checking your vital signs, such as blood pressure, heart rate, and temperature. They will also perform a head-to-toe examination, looking at your eyes, ears, nose, and throat. A careful check of your skin, lymph nodes, and abdomen helps identify any abnormalities or areas of concern, ensuring a comprehensive health overview. Beyond the physical exam, diagnostic tests are often a vital part of a complete medical examination. Blood tests can reveal important information about your cholesterol levels, blood sugar, and organ function. Urine samples are used to check for infections or kidney problems. Depending on your age and risk factors, your doctor might recommend specific screenings, such as a mammogram or a colonoscopy, for early detection of potential health issues. After your examination, your doctor will discuss the results and any recommended next steps, which might include further tests or specialist referrals. It's important to follow their advice and make any necessary lifestyle adjustments, like improving your diet or increasing physical activity, to maintain good health. Remember to check the description for a link to those leak-proof meal prep containers and other great deals. Prioritizing regular medical examinations and healthy habits is key to your long-term well-being.
Thanks for watching. Consider subscribing if we helped you.